Well, I think we have a few more people still to join us, but we'll get started. Good morning, everyone, and welcome to Unsupported Manchester. I'm Ros Bragg, I'm the Director of Maternity Action, and I'll be chairing the seminar today. First of all, a few housekeeping matters. We will be recording this session. If you prefer not to be visible, please make sure your camera's off. You're welcome to change your Zoom name. And the recording will be made available to everyone who's registered and will be put on the Maternity Action website. We have sent around in advance of today's meeting an agenda, a briefing, our survey report, and an overview of maternity pay and benefits. I hope you've all received those. We will be holding 2 panel sessions, and we will hold questions until the end of each session. To ask a question, please raise your virtual hand when we get to the Q&A. Please don't put your questions in the chat. Also, we'll be taking a short break after the second panel session, and we are aiming to finish up at 12:20. There's a small change in the agenda. Graham Whittam unfortunately can't take part today, and so we're going to make a minor change to the order of speakers as a result. Today is the third in a series of regional seminars we're holding on the impact of the cost of living crisis on pregnant women, new mothers and their families. Our first 2 seminars focused on migrant and asylum-seeking women. Today's seminar and the 3 which follow look at women in the mainstream, women who are entitled to work and to access maternity pay and the social security system. If you're interested in the challenges facing migrant and asylum-seeking women, you can find recordings of our earlier seminars on our website. We called today's seminar Unsupported Manchester because it was clear to us that pregnant women and new mothers are being left without support in the cost of living crisis. While there are often mentions of families in the debates about the cost of living, the particular challenges facing pregnant women and women on maternity leave are something of an afterthought. For working women, pregnancy is a particularly precarious time. Maternity discrimination is alarmingly high, with 1 in 9 pregnant women and new mothers sacked or forced out of their jobs by their employers purely because of their pregnancy. For low-income women, this tends to happen while they're pregnant. For higher-income women, this tends to happen on return from maternity leave. Access to maternity pay and benefits is affected by restrictive eligibility criteria, which leaves many women, including many low-income women, without access to this form of support. The vast majority of working women can access maternity pay when they stop work. Some miss out, though, not because they haven't worked enough, but because they don't meet some fairly arbitrary criteria. They changed jobs in early pregnancy, or they took unpaid sick leave during the critical calculation period. Some miss out because of the grossly unfair treatment of maternity allowance under universal credit regulations. Unlike statutory maternity pay, maternity allowance is deducted pound for pound from the woman's universal credit. This leaves many women on very low incomes without any maternity pay at all. There are other benefits which women can apply for. Sure Start Maternity Grant is available to low-income earners, but only for the first child or the first multiple birth. Second and subsequent pregnancies are not eligible. Child benefit is available to all parents, but is clawed back from parents where one parent has an income above the threshold. The maternity exemption certificates provide pregnant women with free prescriptions, but serious failings in the administration of these certificates are leaving a small group of women with large and unexpected charges instead of free medications. Healthy Start is an important source of support for low-income women to access healthy food, but changes to the delivery mechanism means that take-up is very low. These restrictions on eligibility are worrying, but also worrying is just how low the rate of support is for women who receive these benefits. The flat rate of maternity pay, the key source of income for new mothers, is just £173 per week. This is simply not enough. The cost of housing, food and heating doesn't go down when you have a baby, quite the opposite. And the flat rate of maternity pay is now equal to less than half the legal minimum wage for a 35-hour week. There is no argument that we're dealing with increasing costs across the board. Annual inflation is now stuck in double digits. In March this year, the annualised rate was 10%. The inflation rate for food is much higher at 19%, and this makes up a much larger proportion of the spending of lower income families. There is unfortunately more to come. A few months ago, the Office of Budget Responsibility, a government agency, predicted 12 months of recession and for unemployment to increase by 500,000. There are predictions of growth in the future, but these are necessarily uncertain predictions. Even when growth returns, if it returns, the benefits of growth are not evenly spread through the population. We cannot assume that the current financial pressure will just pass. The impacts of the cost of living crisis on pregnant women and new mothers are harsh. For those on low incomes, the pressures have increased significantly. But middle income families are also affected, as large fixed costs such as rent or mortgage can leave little scope for cuts in spending when income drops during maternity leave. Maternity Action's survey of 1,400 women with recent experience of pregnancy and maternity leave found that 71% worried a lot about money, 73% struggled to buy what they needed, 49% bought less healthy food due to higher costs, 35% were eating smaller meals or skipping meals due to costs, 3% had used a food bank, 60% relied on credit cards or borrowing during their maternity leave, 58% returned to work early because of money worries. There is something seriously wrong when pregnant women and new mothers are reporting this level of financial stress. These reports should be enough to prompt government action, but there is no sign that government has any plans to increase the real value of maternity pay or of the wider maternity benefits. The decision not to act on poverty and financial stress will have long-term impacts on women and families. The evidence shows that this impacts on the health of mothers and babies, increases the risk of relationship breakdown, and contributes to the winding back of gender equality, forcing women and men into outdated roles of carers and breadwinners. We need the government to take action to support pregnant women and new mothers, to support new families. We need to think through what we can do to make this happen. What are our priorities for change? Whom do we need to influence? What are the most powerful arguments? And that's what we'll be looking at in our seminar today. We're now going to be moving on to the panel session. We have a great set of speakers today. Some bring their experiences of trying to make ends meet when they have a baby. Some work to deliver healthcare and support to women. Some deliver legal advice, and some are active in campaigning. Our first two speakers are organisations we're partnering in with these projects on cost of living. And the first speaker is Christine Collins from the North West Regional Women's Committee of Unison. Welcome to you, Christine.
Hi, thank you. First of all, thank you for inviting me to speak today. My name is Christine Collins and I am a member of the Unison National Women's Committee and also one of the co-chairs for the Unison North West Regional Women's Committee. I'm also the Women's Officer within my local government branch in Bolton. And I just wanted to say a few words about why Unison is sponsoring research by Maternity Action and how the cost of living crisis is impacting on pregnant workers, new mothers and their families, and to introduce the project. I think we all agree that everyone is feeling the impact of the cost of living crisis, but it's hitting new families particularly hard. I think the failure of the government to ensure maternity pay keeps up with the increasing cost of living is driving many pregnant women workers and families into severe financial hardship. As one of the largest unions with over 1.3 million members, of whom 1 million of those are women, it's vitally important that Unison raise awareness of the issues faced by pregnant workers, new mothers and families. And also we ensure that we are protecting the rights by campaigning for a change. It's important, it's a very, very, very much an important part of the work that we do. And to do this effectively, we need evidence. Unison doesn't have the capacity to do the detailed research. That's why we've partnered up with Maternity Action so we can undertake and provide the specialist advice and expertise needed. There are huge benefits for Unison members from being able to draw on the evidence base this research will generate, as well as the research that will continue to support unions' own campaigning and lobbying work, and other unions will also benefit once the report is complete and published. The aims of the projects are firstly to build a stronger evidence base for widening eligibility and increasing rates of statutory maternity, paternity and parental pay and maternity benefits, which will include information about how the cost of living impacts on health, how the cost of living impact will have an effect on people's health and the inequalities. It will also show how supporting families can address poverty and gender equality. We want to use our evidence to broaden parliamentary support for wider eligibility and increase the rates of statutory maternity, paternity, and paternal pay and maternity benefits. That was a tongue twister. Particularly as we go into the general election period, we also want to ensure that we build the case against the attacks on maternity, paternity, and parental leave, along with the protections against unfair treatment through the retained EU law bill. We're looking to identify strategic legal cases we can take to challenge for unfair treatment in the workplace and to improve rights and work for pregnant workers and new mothers. This is why we've collaborated with Maternity Action on previous projects, including research that was published in December 2021. This was called Unsafe and Unsupported, and it focused on workplace health and safety for pregnant women during the pandemic. It helped Unison influence and change and make sure important change was made within the workplace in safety advice given about risk assessments for pregnant workers. One of the most exciting aspects of the project is that, as well as traditional surveys, we're gathering evidence from roundtable focus discussions and questions and answer sessions and lived experiences from panels, which include Unison members to hear their personal stories and how they are coping with the financial and work situation and having a new baby at home. So that's it for me. You will hear more about the project in itself as from the rest of the speakers. So thank you again for inviting me.
Thanks very much, Christine, and thanks also to Unison for very kindly supporting this work. It is hugely appreciated. Our next speaker is another one of our partners, Greater Manchester Law Centre, and with us we have Sarah Murphy, who's a trainee solicitor at the Law Centre. Thank you, Sarah.
Well, hello, and I'd like to also thank you for asking us here today. As Ros said, I'm Sarah Murphy, and I've recently been taken on by the Law Centre as a new trainee solicitor. The Greater Manchester Law Centre is a justice hub for our community of Greater Manchester. We aim to raise awareness of people's rights, specifically in the areas of welfare, housing and employment. And we want to help people to empower people to enforce their rights, either through our support or our advocacy services. As you're all aware, I'm sure, the paucity of current provision for that kind of support and work is devastating for people, has been devastating for people. I think Jason keeps telling me that we're one of 3 agencies offering free to access employment advice across Greater Manchester. So there's huge potential demand, and as I'm also reminded, that means there's one of us for about every 800,000 people, which is pretty daunting prospect, really. So currently we offer a one-off employment advice service, and the advice is provided by our employment solicitor. With me joining the team, the aim is to build on that service, and we've put in a bid for a legal aid contract specifically to deal with discrimination in employment, taking forward cases to the Employment Tribunal. And this is very much in development at the moment, but the project is an opportunity for the development of a rights-based advice service across community, with resources building on our collective networks to get advice and knowledge of rights to those who need it most. So we're very proud to be a partner with Maternity Action, and we will both be referring clients into their service and hoping that Maternity Action will be able to do the same. But we'll also be modelling some of our community outreach on Maternity Action's highly effective health justice network. We're developing a housing justice network, for example, linking tenant activists, lawyers, and the wider community, and there will be obvious learning across all these areas. And it can also apply, I'm sure, and we hope, to the area of employment. remembering, of course, that it is in all these areas, employment, welfare, health and housing, that the lives of vulnerable people can be most destabilised. And of course, the cost of living crisis provides the perfect storm or the of risk for vulnerable people. So together, agencies like ours, working together, can provide the most effective support when we provide that safety net together. And that's our aim. And we look forward to working with Maternity Action towards that goal. Thank you.
Thanks very much, Sarah. And we are very pleased to be working with Greater Manchester Law Centre on our Manchester-based Health Justice Partnership project. I think it's a really impressive organisation which is really embedded in its community. We'll now be moving to our next speaker. Our next speaker is Maria, who will be speaking about her lived experience of precisely the focus of this seminar, the cost of living impacts on pregnant women and new mothers. And Maria's camera is unfortunately not working today, so we won't be able to see her, but we will be able to hear her. And I know Maria has her baby with her, so hopefully her baby will give her quiet time, but not at all a problem if you need to look after the baby during the seminar, Maria. Can I introduce you now?
Yeah, luckily he seems to be still asleep, so let's hope it stays that way. Yeah, so I've been asked to give a little insight into how it's been really for me trying to raise a baby within the cost of living crisis. I'm basically your average person. I work part-time for the NHS. I've worked part-time since I've had my first child. He's now 5. I stayed part-time as I was trying for a baby, and eventually I've had my child that I've got now. He's now 10 months. So on the run up to, you know, going on this maternity leave, because I was working part-time, I wasn't really able to save because I had the loss in income. You know, I'm not full-time anymore. I didn't have that extra money. So I'd say that I started off on the wrong foot, really, which I think a lot of mothers do, because obviously when you're having your second child, you don't have the savings you have generally, and also you're running around after the first child. We are like a middle income earners. My full-time wage would be around 35k, so I do 3 days a week. It's around 23k generally. So, and I do work for the NHS. So as I was starting my maternity leave, I was actually quite hopeful, thinking, right, well, it's quite good benefits at the NHS. So you get a couple of months of full time, and then you get 4 months of half time, plus SMP. And then you get obviously just a standard SMP rate, which is 170 a month for a couple of months. And then the last few months you don't receive anything. So I was hoping for the first 6 months I would manage okay. That didn't come to fruition because the cost of living crisis hit. And I think I would have struggled anyway, even without having the baby, to be honest. But obviously it was just bad luck that literally as the baby was born, suddenly it was, we're entering this massive energy crisis, and then the food started going up, and I just wasn't able to plan for that level of increase in cost. I had a summer baby, so he was born in June last year. So started off panicking slightly and seeing the energy bills going up. As we got towards the winter, so October onwards, suddenly my energy bill it used to be £80. It was then £300 to £400. And you know, basically prior to even having baby, we used to live month to month really. So my income dropped by a couple of £100, which we could have managed, but because the energy bill's gone up by £300, suddenly we're now £500 down on what we usually would be a month. And it was Christmas. Obviously I had the older child, expecting presents from Santa. It was just real stress, and it caused a lot of upset, as you know, within the family, between me and my partner and whatnot. So it's just been awful, really. You know, it got to the point where we were frightened to put the heating on. I was co-sleeping with the baby because it was so cold at night. I didn't put the heating on overnight. And you know, it's one of them really where I just didn't expect to be put in that situation. And I had a lot of, I'm lucky, I do have a lot of friends that luckily we've all had babies around the same time. And each of them are in the same situation as me. It's not unusual. And we are all what you would call middle income earners. You know, you wouldn't expect us to be struggling the way we all have been. But I suppose it's one of them where, you know, you live within your means. So even if you're earning 40 grand a year, or your partner's on 40 grand a year, if your mortgage is £1,000, then you're still living within their means of having to afford that mortgage. So I've got friends that I thought were really well off, that you know, I've had to give the details of food banks and stuff like that. And that's the other angle as well. So we were struggling in terms of food. I'm lucky that in my area we have what's called a community grocery store. So I started going to there. I think it was £4, and you get 12 items. So I'd go twice a week and basically fill my basket for £4. And I went along with friends as well. So it's not, you know, it's something that a lot of people were using that are on maternity leave in my area. But you know, it's a resource that basically has got that popular and overstretched because people are struggling so much, that just towards Christmas I went and it was bare in there. There was nothing in there for me to put, you know, to even spend the £4 on. So I got to the level then of actually needing to ring. Well, luckily the NHS sent an email to everyone saying if you're struggling, then you can get an anonymous referral to a food bank, which is sickening really when the NHS are emailing their own staff to say if you can't afford food, we don't mind referring you for a food bank, which is basically the email that I received. So I had to go and get a food bank parcel, just moving towards Christmas, which was obviously, I was just mortified about. And I haven't told anyone actually about that. I don't know why. It just feels less embarrassing going to the community grocery store because I'm still paying money, compared to actually going to a food bank. So yeah, I was using a food bank around Christmas time, and things have improved. I was able to access a few resources that I didn't even know were there. So one was Unison were doing the energy support fund, so I was able to get a grant there. That was a couple of £100 to help pay the gas bill. I realised that I could claim benefits towards that time, so I started to claim benefits. I was able to get universal credit. So things have looked up a little bit since around the Christmas time when I hit the massive crisis, and universal credit has marginally filled the gap. I wouldn't say I'm still not receiving what I would if I was earning, you know, my usual wage, but it's helped us. But yeah, I mean, it's just to give an insight really. I mean, I have the benefit of being able to compare my first maternity leave with my current maternity leave. And my first one was when the world was normal, before we had the pandemic and before we had, you know, this massive increase in food and gas and everything. And on my first one, you know, I went off on maternity leave. It was great. I went to baby classes. I didn't have many worries. I was able to save. There was so many, you know, it was much better. I was much happier on my first maternity leave. On this maternity leave, you know, obviously, as I said, I went off, I was already part-time. I mean, there's a reason for that as well, actually. When I went off with my first child, obviously I wanted to return part-time because I couldn't, it wasn't worth me going back full-time because of the cost of nursery fees. So I was arguing with my employer asking for part-time hours, and they basically were forcing me out of my job. And I had to get the union involved at that stage to say, no, you need to offer, you know, hours that would fit around the family life. So it was a lot of stress and upset, and I managed to finally get part-time hours. And then since then, I've been frightened of going back up to full-time hours because I thought I'm going to have another child and I don't want to go through that stress again of asking for part-time hours again. So I've kind of been left, you know, in that interim period where I could have gone full-time. I've been left, you know, struggling financially, really thinking, once this next baby starts school, I'll then go full-time. So yeah, that's a long moan from me, but just an insight into, you know, how people are actually struggling, and also sometimes the unfairness of how employers can be towards the, you know, women going off and having children, having families and whatnot. I'm trying to
Thanks
think.
very much.
I think that's it. Oh, the only thing I would say is just to mention, yeah, I've definitely got a massive credit card debt. I know that was mentioned earlier. I've got a massive credit card debt. You know, there's issues even around that. I've got the credit card debt. I tried to apply for a loan to see whether I could pay off the credit card debt, but because obviously I've got a loss of income, I can't even get a loan. So now I'm just stuck with this credit card that's just spiraling out of control. You know, there's light at the end of the tunnel because I'm going back to work soon. So I'm going back next month, and so I'll hopefully be able to get back on track. But yeah, it's just been a very, very stressful maternity leave, and it's definitely not, you know, it's very general. It's not just myself. You know, there's a lot, and it must be thousands of women out there struggling right now. And just now the babies woke up this second. That was perfect.
No, the baby has excellent timing, Maria. Excuse me. Thank you so much for sharing your experiences. I can hear just how difficult it was to make your way through your maternity leave this time compared to last time, but I really do appreciate you sharing your stories with us.
Thank you.
Excuse me. Our next speaker is Anna Saros, who's Senior Policy Officer at Maternity Action. Anna.
Thank you, Rose. I'm going to talk about the project that we are working on. Sorry, let me just access my notes. There we are. Okay. Yeah, so as you know, we're currently researching how the low rates of maternity pay and benefits are impacting on mothers and children and families during this time, which has been described as the biggest drop in living standards since the records began. So next slide, please. So a lot of the literature on financial deprivation focuses on entrenched socioeconomic disadvantage, often using measures like area deprivation. But poverty and low income can also be sudden or transient, and less research has been done on these kind of economic shocks. However, we do know that these events have similar effects to other kinds of disadvantage. We also know that there is a social gradient in health. As Marmot and his team say, everyone below the top has a greater risk of worse health than those at the top. This means that resources cannot be focused only in one area. Next slide, please. Thank you. So, as we all know, a baby puts a strain on household finances at a time when families are seeing a steep drop in income due to maternity leave and many additional costs. Maternity leave is, of course, the time of recovery. A percentage of women will be experiencing physical or mental impacts of birth. So statutory maternity leave of 52 weeks is a day one right for all eligible employees. And in order to facilitate this leave, we have different kinds of maternity payments and benefits. These can broadly be defined as income replacement benefits, SMP and MA, means tested benefits, and additional support for low income families such as Sure Start Maternity Grant and the Healthy Start Scheme. The basic rate, Rose touched on this earlier, the basic rate of statutory maternity and parental pay is only 47% of the national living wage. That's equivalent to a 35-hour week at the adult rate. 10 years ago, the value was 62.5%. And compared to women's median weekly earnings, the basic rate has also dropped from 42% in 2012 to just 37% in 2022. So the key message here is that a new mother on statutory maternity pay has to survive for up to 33 weeks on just over a third of women's average earnings. It's also worth mentioning that the UK compares very poorly to other OECD countries. Now look at some of the potential impacts. So I will go through the 5 topics that you can see there. And we'll start with health inequalities. Health inequalities can be a matter of life and death. We know that compared with other high income countries, the UK has some of the highest levels of infant and maternal mortality in the developed world. For example, Sweden has half the child mortality rates of England. That's the next slide, please. Thank you. There's a persistent social gradient in stillbirth in England, with inequalities remaining constant over time and during some periods even increasing. And a systematic review from 2021 found that factors like unemployment and being in a manual occupation were associated with a 40% increased risk in stillbirth, and also preterm birth and low birth weight. We also know that low birth weight and preterm birth is associated with a higher risk of death during infancy and early childhood. Survival rates of illnesses, such as some cancers, are also negatively affected by socioeconomic disadvantage. The government has a target to halve the rate of stillbirths and other poor birth outcomes by 2025 as compared to 2010. Overall, there has been a downward trend, but some years, including 2020 to 21, have seen increases, and disparities between different ethnic groups also persist. So let's get on to mental health. The association between poverty and mental health in both mothers and babies or children is well documented. This relates to both long-standing disadvantage and these kind of economic shocks or transitions into poverty that I mentioned earlier. Mental health disorders are some of the most common conditions in the perinatal period. For example, Embrace reports that 40% of maternal deaths within a year of pregnancy are from causes relating to mental health, and the leading cause among these is suicide. Perinatal mental health disorders are also associated with developmental disturbances in children. So one study of pregnant women in Bradford found that depression in pregnancy was associated with lower infant growth at 6 months, particularly in South Asian women who were also more likely to be experiencing poverty. And this study was of white women and South Asian women. With regards to child development and the potential impact on future generations, we do know that poverty or economic shocks are associated with negative effects on child development. An economic shock in the first 18 weeks of gestation was found to lower birth weight by 40 to 70 grams and head circumference by 2 to 3 millimeters in one study. And cognitive development is also known to be negatively affected. As we have seen, preterm births and low birth weights also correlate with an increased risk of death. They also correlate with an increase in long-term conditions in adulthood, such as heart disease and diabetes. Adverse childhood experiences, also known as ACEs, are known to have long-term effects on children's life chances. And studies indicate that social disadvantage both increases the risk of ACEs occurring and also amplifies their negative impact when they do occur. With regards to family relationships, it has been established beyond reasonable doubt that poverty has a negative impact on families. Less is known about the mechanisms behind this, but what we do know is that single parenthood significantly raises the risk of poverty. We also know that family instability and financial problems can be mutually reinforcing. So, for example, a recent study of unemployment and separation in Germany and the UK found that annual separation rate was almost doubled after an unemployment spell in a family, especially for low-income couples. So after a man or a woman in a family had been unemployed for a while, the separation risk was twice as high as it normally would have been. The level of maternity pay is known to be an important factor for women's attachment to the labour market. Well-paid and flexible provisions help to mitigate the baby penalty and help reduce gender inequalities both at home and in the workplace. Men and women have very different experiences after they become parents. Men's earnings are more likely to increase, whereas women's are more likely to stagnate. Between 40 and 80% of employers don't offer enhanced maternity pay, and eligibility can also cause problems for women. As one of our lived experience panelists on this project said, I changed jobs to enhance my career, but it came back to bite me and I missed out on eligibility for enhanced maternity pay. My male colleagues don't have to consider this. Pregnancy discrimination at work is common. The EHRC has reported that 77% of respondents to one of those surveys had a negative or possibly discriminatory experience during pregnancy, maternity leave, or on return to work. I'm going to talk a little bit about migration and asylum. We know that racial disparities in maternal and child health exist. They're well documented. The risk of maternal mortality is almost 4 times higher in women from Black ethnic backgrounds and twice as high in women from Asian ethnic backgrounds compared to white women. In 2020, Public Health England stated the causes for this as including recent migrant status, lack of proficient English, and the policy of charging undocumented migrants for maternity care. Embrace also reported in 2019 that the fear of being charged due to migration status may have been a contributing factor in the cases of 3 mothers who died between 2015 and 2017. In 2021, in recognition of the unfair disadvantage of children of migrant women who are not eligible for mainstream benefits, the Healthy Start scheme was extended temporarily to some migrants following a legal challenge to its eligibility criteria. According to a recent systematic review, maternity services in the UK are failing ethnic minority women due to discriminatory practices and a lack of communication. This may be a factor in the poor maternal outcomes in minority ethnic women, as reported by Embrace. A recent study of 132 NHS hospitals in England found that socioeconomic and ethnic inequalities were responsible for a substantial proportion of stillbirths, preterm births, and births with fetal growth restriction in England, particularly affecting Black and South Asian women in the most socioeconomically deprived quintile. Maternity Action reported in 2020 that women in insecure employment are either denied or prevented from accessing basic maternity entitlements, including leave, time off for antenatal appointments, and health and safety protections. This indirectly affects Black, Pakistani, and Bangladeshi women, as they are more likely to be in severely insecure work. We also know that ethnic minorities are overrepresented in low-paid, precarious employment sectors such as social care, and often miss out on key social security due to eligibility criteria. Thank you for listening.
Thanks very much, Anna. That's covered a lot of the detailed information we know that sits behind some of the debates in this area. Unfortunately, not as many in the public debates, but certainly in the academic sphere. So thank you for covering that, quite a lot of ground with that. We'll now have questions, if anyone has questions for the panel. As I said earlier, would you please put up your hand if you'd like to ask a question, rather than putting it in the chat. So if people would like to raise a question for anyone who's taken part in the first panel this morning, please let us know. Karen.
Is that me?
That's you.
Yeah. The reason I want to ask a question is just I need to rush away because I have to go to a poverty meeting for 12 o'clock. That was excellent, that presentation. I have to say it's covered a lot of the things that I had questions about, especially in relation to postnatal depression, you know, about the economic factors there. I just want to highlight, I'm from Unite the Union, And it's something that's just come to my attention. And it was the previous speaker there had talked about the NHS maternity pay, where it's 2 months full pay, 4 months half pay, plus statutory maternity. Within the finance sector now, it's very, very common. It's 6 months full pay for women. It's also up to 14 weeks paternity pay for men in the first year. That's quite common. Sainsbury's Supermarket is now paying 6 months full pay, and I think it's 3 or 4 months full paternity pay. And the point I just want to make is, yes, statutory maternity pay went up £20 this year, which is good, but it should be increased for 12 months. It also should be raised. And the public sector terms and conditions, especially in relation to maternity pay, is shocking. Local government, NJC, is shocking. I had children 30 years ago. It's still 9/10 for the first 6 weeks. Then you go down to half pay and statutory maternity pay. I think it's maybe for 12 weeks. I'm not sure off the top of my head. Paternity, shocking. It's a full week's pay. And then it goes down to statutory paternity for the second week. That hasn't changed in 30 years. And when you look at it, is such a big employer of women. So is the NHS, so is local authorities. And I think we have an opportunity here, especially when they're all out and strike over pay, because it was a disgrace there. Pensions went up about 10%, statutory maternity pay went up as well. I think it was 10.1, minimum wage went up, which were all positive and welcome and should have happened. But public sector pay, that wasn't mirrored with public sector pay. So I think we need to be targeting, and unions need to be doing that with the public sector and calling them out for their shocking statutory maternity pay and paternity pay. And I actually think we should be looking at a taxation system where men or same-sex partners are encouraged to drop maybe a day as well as women. There should be some sort of tax incentive allowing women to go down to a 4-day week or drop their hours by 8 hours or whatever. And also their partners should be able to do that too, so that it's not just women who are changing their working patterns to accommodate children. They're talking about giving out free childcare, which Northern Ireland hasn't got yet. But I actually think parents should be given the opportunity, rather than giving out free childcare, the opportunity maybe not to work, or to work less hours without any financial penalty. That's me.
Thanks very much, Taryn. I think there's lots of good ideas in that one. But really helpful to hear the work that's been done within the union to try and create change in the workplaces. Next hand up I can see is Veronica. Veronica, would you like to speak? You're on mute. Thanks.
Hi, I'm from Earlham KZ Food Bank. We're a small food bank in Salford, and we do get quite a few working women who've just had babies and who are struggling. And the thing I'm interested, well, quite a few of them work for the NHS, and they are really struggling. But I don't know what union they're in, apart from one lady who I do know is in Unison. How do they access the Energy Support Fund? Just really so we can signpost those people, because a lot of I'm absolutely certain that the clients we see are not sure that that's there. I don't know it's there.
That's a very good question, Veronica. I'm not sure if I should put Christine on the spot to answer that on behalf of Unison. Perhaps we can do some homework and put an email out to the group after the session with that information.
That'd be really good. It's just so we've got information to signpost people to. Yeah,
no, absolutely. I think it sounds like a very useful resource for you to be able to signpost your women to, and indeed all of the people coming to your food bank. Thanks.
Thank you.
Thanks, Veronica. Are there any other questions or comments? I can't see any hands up. Hope people know how to put their hands up using Zoom. If not, put your camera on and just wave. I can see some of you. No more questions? Okay, there'll be an opportunity for more questions and comments after the second panel, which we'll move into now. So our next speaker, I'm very pleased to introduce Sue McAuliffe. Sue is matron for public health at St Mary's Oxford Road and St Mary's Wythenshawe. Sue, can I introduce you now?
Hello, and thanks for inviting me to speak today about the impact of the cost of living crisis during the perinatal period. Okay, Michaela, next slide, please. So my role as public health matron is all about preventing ill health and understanding those wider determinants of health that shape our health and positively influence the modifiable factors that can improve our health and well-being. And as midwives, I guess we're key public health carers, information givers, and protect and enhance the health and social well-being of women. And this promotes the health and well-being of society by reducing health inequalities. And we have talked about the health inequalities today, and we understand that those suffering from health inequalities have poorer outcomes. But we really are all about trying to improve that and reduce stillbirth rates, preterm and low birth weight babies, to name but a few. So the cost of living crisis impacts all aspects of life, as you've heard today, and the slide shows some of them, which we'll talk about in further detail later on through the presentation. But the key thing is that poverty always results from a person having insufficient money to meet their needs. Next slide, please. So during the cost of living crisis, we've seen that obviously people have key priorities. You know, you've got to pay your mortgage, you've got to pay your rent, you've got to pay your fuel bills. And the thing that kind of gets where people pull back the most really is around food and the budget for food. So what's left in the budget for food? So sustained data back in September 2022 showed that 9.7 million people in the UK were struggling to get enough to eat. And 620,000 people in Manchester were suffering food poverty. The key thing is as well is that we know that if we can get our 5 a day in, it's really good for us. It's really good for our health. And if we don't get our 5 a day in, you know, our health really suffers. And the British Nutrition Foundation has shown that up to 42,000 lives a year across the UK could be saved if we all manage to get a healthy diet and get our 5 a day in. Next slide, please. Unfortunately, we can see there's a sharp rise in food insecurity across the whole of last year and continues to increase this year. So in maternity, one of the things that we've really focused on over the last 18 months is trying to increase the uptake of Healthy Start, which is a nutritional safety net. It's a small amount of income that women on low family incomes can claim. The rate across Manchester at the moment is about a 65% uptake. And we've managed to get some of that uptake up. The highest postcode we've got across our footprint is 88% uptake. Some of them are around 77% uptake. So we've managed to increase that uptake over the last year or so. But we've still got a lot of work to do because some of the areas where we have a lot of families living with English not as a first language, the uptake's really low. So we've got an awful lot of work to do around trying to improve access for those families. Next slide, please. Healthy Start is really valued by women, really valued by women and the families that we work with. And I'm not going to read all these quotes here. These quotes I'm working with a national research team to review Healthy Start at the moment. I'll just read part of the last quote. And this lady said, absolutely, my children's diets improved as a direct result of Healthy Start because I I always knew I had £12 or so on the side per week just to get fruits and milk. And without Healthy Start, you might have to think maybe this week I can do without and just get the milk for cereal and maybe fruit next week. Next slide, please. So this is just a photo of one of the engagement sessions that we run. This is Hayley and one of our midwifery support workers and student midwives. And we're really kind of trying to encourage women, well, just tell everybody about Healthy Start, really, because if you're not entitled to it, you might know somebody who is. And then signpost our women who need support to apply well, we've got Grace on the call today and she's going to tell you all about that later. We've worked really closely with Grace and Manchester Central Food Bank, who've really supported us brilliantly over the last 18 months with this piece of work. Next slide, please. So our last presenter really kind of nailed it in terms of the impact of the cost of living crisis on health. But yeah, I've just listed a few issues here. I mean, the key thing is poor nutrition, and that can be maternal obesity because you can only afford to buy foods that aren't particularly nutritious, that might be high in fat and salt and sugar. You buy one, get one free from the supermarket. Or it could be that you're just missing meals. It could impact on weight as well. But poor nutrition is the key thing. You've got less money to spend on physical activity. You can't afford gyms when you haven't got enough for this shopping. So we've been doing a lot of work with Manchester Active around the provision of low-cost physical activity for women, because being physically active with other women really impacts on it supports mental health. It helps with social isolation as well as its impact on physical health too. We know that not having enough money increases stress and can exacerbate existing mental health conditions, can also impact on infant feeding. We know that the price of formula milk has gone up, and there's been reports of women watering down formula feeds because they can't afford to buy as much. And also with breastfeeding, the impact of stress can reduce your lactation and your letdown reflex, so it can massively impact on breastfeeding too. We've mentioned relationships, parental conflict, domestic abuse, bonding with your baby, and of course this impacts on adverse childhood events. Stress can increase the risk of you lapsing really into risky behaviours like smoking, alcohol and substance abuse. If you can't pay your rent, you might have to try and find alternative accommodation. You might be end up being homeless. Your lifestyle could be quite chaotic. You could feel quite unsafe in housing that's not appropriate. This can impact on safe sleeping for babies. Social isolation is a massive thing, that feeling that's been mentioned today on numerous occasions of shame and guilt. And this can all impact on your ability to access care and support. Next slide, please. So for midwives, making every contact count is really important. Right from the very beginning, the booking appointment, we create a personalised care plan developed with the woman, and this covers all aspects of health, physical, mental and social. And every single future appointment then is about building relationships, building trust and delivering that safe care. It's really important to have trusting relationships. Midwife means with woman, and that's really key for us, because it takes a lot of courage to open up about your personal circumstances. So those trusting relationships are really key. Next slide, please. So we can't do things by ourselves. We all have to work together. And it's all about working in partnership and building those great working relationships so that we can wrap all the different sort of roles and skills that we all have around our women and families so that we can give them the right support at the right time. And these are all the different organisations, or some of them actually, organisations that we work with and that I work with. Family hubs are a new way of working across children's centres, and we're going to be opening some new family hubs. They're not new buildings, it's kind of a model of care, if you like, where the key priorities are about connectivity between organisations, building relationships between organisations so we all actually understand what each other does. We get to know each other so that referrals are really simple and straightforward. And that then improves access to the services that women and families need. Next slide, please. So the next steps around the Family Hub model, as I've said, it's this multidisciplinary, multi-agency team working, keeping the families at the centre of everything that we do. It's not about referrals or interventions, it's about everybody understanding that together they can make the difference that's needed. And if a Family Hub is working really well, an indication of that is that the family only really has to tell their story once, because everybody that's working with that family understands what that family needs and works together to support that family alongside that family. Next slide, please. So that's it. And yeah, I mean, the key message is it's tough out there. It's really, really tough. But if we can all work together, we can help each other through it. And thanks for listening.
Thanks very much, Sue. I think that's a really clear picture of the public health analysis of the cost of living crisis and the very practical ways in which you and your colleagues are trying to bring together the services to address the stress and pressures on women and their families. So thank you very much for that. Our next speaker is Dr. Gertrude Wafula. Gertrude is from the Caribbean and African Health Network. Gertrude, would you like to?
Thank you so much, Rose, for that. I hope everybody can hear me clearly. I'm very grateful to share the work from CAN and the issues we are facing around the cost of living and impact of women, especially women of color. My colleagues have shared quite very important information, and thank you for the data that has touched across some of the BME communities and women in particular. So the approach I've taken, if you could give me the slides, please, is to look at the general overview in terms of impact. We have already, next slide, please. We have already seen that we have a lot of inequalities around health. So CAN is the Caribbean and African Health Network. So I'll just give you the overall positioning of Black women in health and employment. But from the previous speaker, you have seen there's a lot of disparity, and actually this starts early. From the courses people take, the degrees people get, and eventually the jobs are those ones who have education, that's to say. But some of people who don't have the opportunity, they're always in lower paid jobs, and that impacts on the quality of life in general, what women get, what jobs they get, how they bring their families and the general well-being. So we are going to look at some of that impact, but I'll lead you to the practical aspects of where actually things are and how we are at the moment. Next slide, please. So we know we address, as CAN, we address disparities in health of Black and Caribbean community in the UK. We work with communities, but of course with partners like you in terms of influencing change, policy, and practice in service delivery. That's about CAN. Next slide, please. From the several data you have seen, there has been actually increasing levels of disparities around women and the health. And we have seen from the previous presenter that actually this trend is not changing. And I was just looking at Mahmoud's work from 1999 to 2019, we have seen a lot of studies that cover so many mothers, over 17 million, but you see the changes in mortality deprivation over the years in the UK and Ireland. Actually, things are not really getting better when you look at the progress in terms of women's health and where we are as a nation and as a community. Let's go forward, please. Next slide. So what we have found that the socio-economic inequality, even from the previous speaker, we have seen that that is actually having a lot of impact, and especially women and children of color. When you look at things like obesity, when you're looking at child mortality, we have so much happening this in our community. Females' life expectancy in England over the last 10 years, things have really changed. We can also talk about austerity and cost of living, but the fact is that Black women are 13 times more likely to have postnatal depression. 23% of women from the Black community are likely actually to die. And we are talking about the present 2023, 2020 data. This cannot be acceptable anymore. And we cannot also forget that women of color, in terms of mental health and well-being, the 3.7 times likely than other population to actually face the issues. So we need to look at the mirror as a whole, but also the position of Black women in the UK. Next slide, please. So when you go even forget about women, just look at the cost of living in a Black community. From every source around, forget even about academic area, journals. Look at something like Running Trust. Look at sources like people like us. And the progression from 2022 to April 2023, when you're looking at The Voice, 6 in 10 Black people are forced to borrow money or live in the situation where we are. For them, it's not just a problem, it's just a crisis. You're looking at 96% of ethnic minority groups are actually experiencing crisis more. And whatever happens in the whole community, it actually mirrors the situation of the woman. In some way, I would say the women in the Black community are almost like the focal point of health. So if they are affected, you can imagine what's happening to the children. Next slide, please. So as you have seen, the bank, access to food bank, has been one of actually the way we have really seen the measure of the issues around poverty. And you can see here, this was from FAN, we have almost at least 1,172 independent food banks in the UK, and that was 2017. That has actually mushroomed. So I'm going to give you some of the data we have had in terms of the support CAN has taken in terms of assisting women and people from the BME community around responding to food crisis. Of course, food and nutrition is the bedrock of health. And the data from Adwick and Longsight, the period between 21 and 22, things have really changed. It was just set up to take care of people no more than 5 years. But 10 years down the line, things have really changed, not for the better, but for the worse. Next slide, please. So we have tried to look at where are the issues and how can we respond. We are still getting more data that is going to help us compare exactly differences between men and women, people who have access to resource fund. So we have the cost of living survey going on where we want to hear from the people. But the data so far is showing areas of really worry. And I'm going to use this data together with the food bank to show you that we cannot sit back and wait, because what's happening to Black women and the BME community around that is really life-changing in a way that can impact us for a very long time. Next slide, please. So from a snapshot of survey, we look at people who are responding to this. Almost 66% don't have resource to public fund, which means this crisis can only deepen. And compared to the pre-COVID situation, 50% are saying things have actually really changed to the worse. And we are seeing that at least people are struggling. 67% are struggling with food. 54% are struggling with utilities. People cannot even afford transport. That's almost 51%. And though people are trying to cope, and the coping mechanisms are not really good. By you cutting off heating, if you have children, if you're a woman, and you're cutting off sources of food, you are cutting off other ways to work, but you're depending on borrowing and credit cards, then we are having a situation where, unless this intervention, this doesn't really look really good for the women from the Black community. Next slide, please. Now, it's just a little bit of a snapshot from the food banks that you see. And I want you to look at the blue, the lighter blue one that we have here, where we are looking at only data from January to March. You can see, if you compare that data with the years from 1919 and 2023, the numbers of people who are accessing the food banks, or parcels that have been given, were really enormous. And there could have been a little bit understatement, because things like bread, vegetables, some of these have just been given without weighing. So on average, families have gotten between 20 to 40 kilos a week. Some go even over 70 kilos of food supply. COVID was really a special point where you had all those hit high. But when you check between that 2019 and where we are now, the situation does not really look very, very friendly. Next slide, please. We also see that, just looking at that, looking at, okay, 2021, we know COVID was there, but just the first quarter of 2023, as you see, if you have around 959 parcels that have already been given, and that's the end of February. And because we had some technical problem with the computer, some of these have not really been all registered in. So we still have more numbers that you can see here. Next slide, please. So when you look at in terms of household, in terms of the parcels, you see that the trend is increasing. But I want to take your attention to asylum seekers, refugee. And you see that in terms of, they're given 42 quid a week. And then when you have a child, they give you £3 more. What does £3 now in the present world really give you? So this situation, mainly for asylum-seeking families and refugees, they are telling a different story. So if you're a Black woman, you're asylum seeker, you're a refugee, the issues are even further multiplied. Next slide, please. So now that we have seen the impact, the next step, the different groups that we have, we also see that actually referrals are coming from a wide range of organizations, from schools, some are coming from probation services, from mental health services, professional signposting people. But you look at other areas like from housing association, all these. So we have problem of housing, you have problem of food, but we have also GPs actually referring people to these services. So it's not just one spot, but everywhere, the interagencies here that are working in terms of coming in. But some people who refer themselves, almost 16% of the people actually refer themselves to the services. And we have quite a lot of here where we see it's not just one spot problem with CAN, but the problem is faced by so many agencies where our communities are moved. The next slide, please. So what I'm saying, the main reason of referral, and there where I link the cost of living, unemployment is around 11%. That's the reason why people come in. Benefits or delaying benefits or waiting to have a benefit claim, almost 20% of people are in. And look at the large chunk of around 22% budgeting issues. People are really facing a lot of issues here. 70% have no resource to public funds, which means they will depend on these banks for survival. So imagine in pregnancy, or you expecting, what does it really impact on the general well-being? The next slide, please. So with those few points on in terms of referral, in terms of it's affecting, in terms of the community, when you look at the breakdown, and it's just associating mental health and the cost of living, and even from the survey coming in, the mental health is one thing that's really affecting many of our communities, Black communities. But it looks not only just in the center of Manchester, Ardwick, Barnage, Piccadilly, Rasham. So all these issues, these professionals who are providing mental services to all these communities, look at around 116 people have come from those services. So cost of living, mental health, and well-being goes really higher in terms of where we need to put our attention. Next slide, please. So in my summary, given the interest of time, we need to look at reality. The reality is, at the moment in time, the way the economy is, the way food is, the way we are in terms of employment, our mental health being affected, the well-being of the Black community, livelihood, and the future of inequality is still being driven. So the question is, over 10 years, 20 years, this is still going on. What can we do as professionals, as partners, to actually have a second lens where we look at the Black community and to say, we don't have to have our children still dying because of where people are. That inequality really means the same to everybody. Addressing this as professionals, we are addressing every woman as a woman who needs support. And these are just not numbers. These are lives. These are our women and our children. And with that, I want to say thank you for listening. And I hope the deliberation, the things that we do as professionals, we look at serving the women because they're the mothers of the nation. Thank you very much for listening to me. I'll take any questions before I run to my class.
Thank you very much, Gertrude. That was a fantastic presentation. I know you have to leave the class. Can I just check, when do you need to go?
My students are doing some research at the moment in time, so I'm happy to take some questions, please.
Okay, well, we'll do questions now. Just so if we can hold on questions for Sue's presentation until later, but if anyone would like to ask us, Gertrude, a question while she's with us, please put your hand up rather than putting it in the chat. I can't see any questions. That may be me and technology.
Thank you. I can't see either. So thank you so much for listening to me. If there's anything, info@can.org.uk, and I think you'll share our details should there be any conversations, but we'll look at the conversations where partners we can work together to improve the well-being of the Black women in our Greater Manchester. Thank you so much, panel, for listening, and the participant for listening to me, and for the people who shared, the lady who shared about her experience of really the hardship that mirrors everywhere in our communities. And you can really feel not just one voice, but that voice makes so much difference by us hearing. So we need to do something about that. Thank you all for listening, and you have a great seminar. And I'm sorry I had to leave quite really quickly. Thank you so much.
Thank you very much, Gertrude. Thank you.
Bye-bye.
Brilliant. We'll now move to our next and final speaker, Grace Harvey. Grace is Campaigns Coordinator at the Manchester Central Food Bank. Grace.
Hello. Hi, thank you. I do have some slides, so I'm going to share those if that's okay.
Grace, I think you've muted yourself. I can't hear you.
Oh no, I think it's not allowing me to share my screen and speak. So Michaela, can I just really quickly send you the slides? Sorry, I should have done this earlier. Sorry, everyone, this is not ideal.
That's quite okay, Grace. There's always a technical hitch. This is ours. So I think you're sending your slides through to Michaela, are you?
Yes, yes.
Okay.
I've just sent them off now.
Lovely.
Amazing. I'll pick them up and I'll share with
Sorry, thank you.
That's quite okay. Do you want to take a moment till Michaela has them, or would you like to get started
Yeah,
and she can join
yeah,
them at them when she's got them?
Thank you. Yes, so first up, thank you very much for having me to speak here, and thank you for the opportunity. It's been great to hear what everyone's been saying so far. I am a campaigns coordinator at Manchester Central Food Bank, and half of my time is designated to a Healthy Start uptake campaign. So we work with the wonderful Sue, who's on this call, and I'll speak about that in a little bit in my slides. But yeah, so our general aim is, of course, to increase the Healthy Start uptake in Manchester. In my slides now. Thank you, Michaela.
No problem.
You can go next slide, actually, if that's all right. Thank you very much. So yeah, I'll start with why our food bank became so interested in Healthy Start. This all started with our food bank sessions. So my former colleague Freya did some research into healthy families who might be eligible for Healthy Start who were attending food bank sessions, and through this research it was found that families who receive Healthy Start might not then need to use a food bank. And of course, as a food bank, our entire aim is to not have us exist. So this sort of became a priority. We understood that uptake was really poor in Greater Manchester generally. So yeah, we went from there really. We got funding through Trussell Trust to continue this work, and it developed into a full uptake campaign. Next slide, please. So these are just some of the stats that are really important. So more than 60 million is going unclaimed by families in Greater Manchester. And that is based on the total eligible children who aren't claiming, and the money, which is £1,230 across 4 or 5 years. So this equates to 35% of eligible families are going without this money. Next slide, please. And if you click again, I think these are animated, so they should just pop up, Michaela. If you click twice. Thank you, sorry. So this is the amount of children, according to Healthy Start, NHS Business Authority, who run Healthy Start. These are the amounts of children who aren't claimed for. These, it's really important to note that these don't take into account any NRPF families, because NHS Healthy Start gets their data through the DWP. So anyone who's not in touch with the DWP isn't counted for here. So this is a definite undercounting. Next slide, please. So our approach then, as I said, we're obviously a food bank, so we're trying to reduce the number of people using a food bank, and that is why we're so focused on Healthy Start. Our general approach, the foundation of everything we do, is to get money in pockets. So that's a massive drive for the campaign, first of all. We are rights-based. We do a lot of research into the underlying reasons why people aren't claiming Healthy Start, and we'll get onto that in a little bit. We're grassroots-led, which gives us really good connections with communities. I'm out and about a lot in various community settings across Greater Manchester, which is really great. And our whole idea is to build collective capacity. We're funded until December 2024. So our idea is that we create a framework of everyone who's trained, Healthy Start champions in Greater Manchester, and pass on all of our learning, all of our resources, the posters, the toolkits, so that everyone else can continue our work, essentially. Next slide, please. So our Healthy Start uptake campaign sits in our wider Equal Start network. So this I have two parts to my role. Half is Healthy Start and half is anti-poverty work through our Equal Start network. So this includes all of these things. So we do co-located advice provision with 12 a network of schools across Greater Manchester, and that's 12 schools in total. We offer cash first support, uniform provision for schools, and up in Blakely we run weekly parent and family sort of relationship building workshops where we explore things like healthy eating, financial inclusion, all that kind of stuff in a really friendly setting where we try to build some community. So yeah, Healthy Start sits amongst all of this, and we've just launched our website, so that's our website link there. And we will be uploading different briefings and different resources and stuff that we have, so yeah, definitely check us out, and yeah, we'll keep you posted on anything that's coming. Next slide, please. Oh, if you could just go back one, thank you. So in terms of our Healthy Start uptake campaign then, for those of you who don't know, I'm sure you will do, Healthy Start is an NHS benefit. It's paid every month onto what is essentially works like a bank card photo. It looks just like that little photo there. It's £4.25 a week during pregnancy, and then after your child turns 1 up until they're 4, and when baby is born it doubles to £8.50 a week. So it ends up being a substantial amount of money really to top up your weekly shop. You can buy fresh fruit, veg, milk, things like that with it. So our Healthy Start uptake campaign involves all of these things. The main thing that I do really is one-to-one support service for families trying to access Healthy Start, and that's where our partnership with the wonderful Sue comes in. So every week I do a drop-in at St Mary's Hospital in the antenatal clinic waiting room, where I'll chat to lots of families, chat to lots of expecting mothers about the scheme. I also give out the free vitamins, Healthy Start vitamins, and this is a really good way of promoting the scheme and doing applications one-to-one with women. We have little cards that you'll see on the next slide that we give out, and that midwives also give out during their appointments, and these have my contact details on, so I run a one-to-one support service, as I said. So yeah, that's really handy. I support women to apply and we explore any barriers, and that's where we've got a really good understanding of the barriers that women are facing in accessing Healthy Start through that. I also train professionals and various organisations on Healthy Start, so that's definitely something I can do for you guys if anyone is interested. And again, yeah, a lot of research and evaluation. We really are just sort of, it has been a year now of this project and we've been trying a lot of different things. So yeah, that's where we're up to so far. Next slide, please. These are our posters and the cards that I was talking about. So the back of the card advertises the drop-in in St Mary's. And yeah, if anybody wants any of these, I can definitely get some to you. Next slide, please. Thank you. These are animations again, Michaelis, if you just double click. I think there's 3 on here. Yeah, thank you. So in terms of how impactful we've been so far, I recently did at the start of this year a sort of pull of all of our data of everything we've been working on so far. So this data is from the period of February 2022 to February 2023, and we first got funding for this project last January, so it hasn't been that long. So in total we've reached 583 families directly, so this is through all of our drop-ins, we do lots of outreach at different Sure Starts and community events as well, so all the families are reached through that support. So these are families who emailed, who called, who contacted me to ask for support with Healthy Start. Click again, Michaela. There should be another QR code that we have over 4,200 clicks on that, which is really, really good. Means that, yeah, each of that is good. Michaela, next slide, please. Thank you. Yeah, twice again, all the work we've been doing. this is how much money we've got into the pockets of the families we've worked with. So this was 36 of our families who successfully claimed Healthy Start after speaking with us, and we did the application with them. And this equates to 1,162 average per family. This, of course, this is a bit of an undercount of what they should have been claiming, because lots of these women were coming through when they should have been eligible 2 years ago, but just didn't know about it. So this figure should be a lot more, but that's what we've got so far. Next slide, please. This is a general overview of things we've supported with. So lots of the work involved general support. And if you click again, Michaela, it should come up with the things we helped with. Thank you. So yeah, these are all the things we supported with. And then I've broken this down into the things that service users came to us with. So some wanted backdated payments, so to get the money for the time that they missed when they were eligible, and etc. Some were existing claimants who had issues with their Healthy Start card. Next slide, please. So this is outcomes of those 214 families we supported, and there were a few things I just wanted to note around this, just to highlight really the huge issues with the Healthy Start system generally. So we'll start with the 16% that are now claiming. Those are the families we supported to claim. 27% were ineligible, and I just wanted to flag these figures down here in the bottom left, because the families that weren't eligible, these are people who are accessing the benefit system, and essentially their universal credit or whatever legacy benefit they're receiving is just not enough. The threshold to be eligible for Healthy Start, if you're on universal credit, is £408 a month. So some of these were families who were earning £500 a month through one of their, one partner working, which is just obviously incredibly low. So yeah, I just wanted to flag that they're not ineligible because, they're millionaires. It's because, their universal credit just isn't enough. Michaela, if you could click again, I think there's one more at the top. Yes, so this unknown category, these are people who we sort of just lost contact with. So we did lots of follow-up texts, lots of calls, but they just never got back to us. And that's after we supplied them with information or spoke to them about how they can apply for Healthy Start. So if we go off the data that we have for the 36 families that we helped to apply, we estimate that this is the amount of money here that is either claimed by those families who didn't get back to us, or that is being missed out on. But if we go off what they claimed, it means that we've secured around £200,000, which we're very pleased about. Also, I just wanted to highlight the red segment here, eligible but not claiming. I'll go on to speak about that in a minute. So yeah, if you could go to the next slide, please. Thank you very much. So this is sort of the most outrageous and scandalous part of this whole thing, as we went through the data, is that 20% of the people that we supported were completely eligible for Healthy Start, but just weren't claiming because of the systems, like the systems of the DWP and Healthy Start, that were sort of trapping them and stopping them from accessing money that they're completely entitled to. So I've got a more detailed breakdown of each of these elements, but just generally speaking, the Healthy Start failures that people were coming across were just Healthy Start, reporting technical issues on their end without any explanation, any resolve, payments randomly stopping as well, there having been no financial change, nothing has changed in that family's circumstance, or this is the biggest one, applications just continually unsuccessful, without any explanation from Healthy Start, without any resolve, just going back and forwards, trying every single method to apply to Healthy Start, because you can apply online, you can apply via email and via post, depending on what benefit you're on. So the method of applying is just incredibly complex. And every single family we worked with who couldn't access Healthy Start due to this had endlessly tried to call them. Sometimes the waiting on the phone, the waiting times were like an hour plus. And Healthy Start charges if calls are not in your data plan, or if it's pay as you go. So these families were racking up often quite a bit of money on just waiting to speak to them. DWP system delays, again, so Healthy Start isn't a DWP benefit, it stands alone, but they do use the same data to apply. So for families who are maybe making their first universal credit claim and it takes 5 weeks to even get that through, and then you've got to wait 2 months to be able to apply for Healthy Start. So all that time whilst you're eligible, you cannot access the benefit. Also families who were waiting for the DWP to update their account to show that they'd had the baby or to show that they were pregnant so that they could claim for a Healthy Start. Yeah, a whole host of issues, but generally just highlighting how, yeah, these social security systems are just the most inaccessible and make things so complex and so difficult for these families. And yeah, just the figure that it's 20% of people we supported were having these issues. And if you click again, Michaela, there should be a figure. So we've estimated, based on the 36 people we supported to apply, the sizes of the families, the amount of children they've got, and the average weekly payment that they received. This is the amount of money that 20% of the 214 we supported should have claimed. So that's what they've missed out on, which is obviously outrageous. Next slide, please. Oh, sorry, yeah, thank you. These are just some quotations from the families that we worked with, just to highlight some of the issues and some of the impacts that not being able to access Healthy Start, or the fact that Healthy Start now just isn't in line with inflation. It's still £4.25 a week. I spoke to families who are paying £15 a week for 1 pack of formula milk. So yeah, just wanted to highlight some of these. I'll leave these up for a second just so you can have a read through. But yeah, a lot of our sort of next focus is around not just the Healthy Start system failures and the fact that the system itself doesn't work, but also what a Healthy Start should actually look like for families in Manchester. Because yeah, the money just isn't enough even when you're claiming Healthy Start. Leave those up. And then next slide, please, Michaela. And then, yeah, you can just click through these, thank you. So what next? So I'm here at your disposal really for any training. All the posters, all the flyers you could ask for, we can get those to you. Yeah, we really want to work on the promotion side of things. So yeah, just get in touch, my email's there below. In terms of further updates on our work, so I am pulling together sort of a briefing for all of the data analysis that we've done. The stuff I've just talked about there is just the surface level, really. There's lots that we've explored and discovered. So we'll be posting that up on our website, and I can get that to you all if you request it from us. And then in terms of just what's happening next with our project, we are funded until December 2024. And again, our idea is that when it comes time for us to step away from this, that all of our learning, all of our practice, all of our resources and all the toolkits will be available for other professionals to sort of take that and run with it. So if there's any collaborative working that we could be doing with any of you to make that happen, to get a framework set up that is really robust, that works with people in the community, where women are accessing services. We really want to have tried to do this from a bottom-up approach rather than top-down, just because we know that's what works for the families that we work with. So it would be really great to work with any of you in any projects that you have to get that going for when we step away. And that's everything from me. Thank you again. If you've got any questions, let me know, or my email is there, so you can just drop me an email. Thank you very much.
Thanks very much, Grace. That sounds like a really, really valuable piece of work, and I can hear your frustration at the system that you're dealing with, letting you down so badly. Okay, we'll move now to questions. If people have questions for Grace or for Sue, who spoke earlier, would you put your hand up? Please, if you could put your hand up rather than put your question in the chat, that would be very helpful. It's much easier for me to see it. And I should add, I think Christine has put some information in the chat about the energy scheme that was asked about last time. So it's useful to have a look at that if that's something you're interested in. First question, Veronica.
Hi, thought it was a really good presentation, Grace. Amazing, really informative. Healthy Start's been an issue for our food bank. we are, like I said before, a micro food bank, nothing compared to the size of your food bank. But one of the things we do have issues with is people don't seem to know about the Healthy Start at all. And I absolutely do fully appreciate how busy midwives and health visitors are. Absolutely. They're on their knees as well as a service. But in our experience, the new mums are not being told about this. So, and the other thing is that we find it hard for people who English isn't the first language to get translation services. So we can explain to these people this is what they're entitled to, and for somebody to help them. So my question is, the posters and cards that you put up as a slide, do you have those in different languages? And two, does your service have access to translators to help those people who English isn't the first language?
Yeah, thank you, Veronica. Really good questions. So the posters that I showed there, they're obviously not in different languages. I am hoping to do a full translated toolkit. So we did that last year with because paper, it used to be paper applications. It's only just gone online last year. We translated everything, so we've got to do that again. So I'll definitely get that to you, because I echo what you're saying in terms of it's Healthy Start have translators on their call lines, but it's getting families to that point where they're talking to Healthy Start that's the real issue, and having them understand what it is. We do not have access to translators, which is an issue. We do have some team members who speak different languages, and it's really helpful when they're there at the drop-ins to relay that information. But yeah, it is definitely something we're aware of and we are working on. So I will keep you posted on any translated resources that I see. Yeah, I mean, Sue, I don't know if you on that as well.
The translation, I mean, we never ask the clients to use their phone for translation services, because they're usually they haven't got the data, or it's a paper go. So we use our food bank phone to translate, but it's still not ideal, because we can't help them apply online, and we're not a designated service like that yet. So I was wondering, we are in Salford. Well, actually, I'm saying we're in Salford. We're virtually in Cheshire, Earlham and Cadishead. We're right on the outskirts, and I'm wondering, are any of the 12 schools in our area that you've worked in, are they in our area? And would you be prepared to come out and do some training with us? We are 9 miles from Manchester. Yeah,
I can come along. That's absolutely fine. Right. In terms of schools, I think the furthest one out is Rochdale. Right. But yeah, I can come and do some training with you. That's absolutely fine, definitely.
Okay, thank you.
Lovely, thank you. And I think, Sue, you were putting your hand up to comment.
Yeah, I just wanted to say one of the things that we are working on is Julie Heslop is the Deputy Director of Children's Services for Manchester. And we have been looking at training up Healthy Start champions in all the children's centres, but Healthy Start champions who speak the local languages. And so we want to give them really robust training, so that, because it's not always just having an awareness of the Healthy Start scheme, it's also navigating the application process and dealing with the challenges of it if you get knocked back. So it's having somebody that really understands how to navigate it properly, and have those language skills to be able to say, look, if you get an email to say you're not eligible, come back and see me, and we'll look at that and we'll just see what the problem is. Because it is quite complex for many. I mean, for some it's very straightforward. If you're on universal credit, it's often very straightforward. But if you're on legacy benefits, or you're a young parent, or you have no recourse to public funds, it's quite complex. So it's having those Healthy Start champions that speak the local languages embedded into those communities, and that's what we need. But we've recognised that, and it's happening. We are starting to train those Healthy Start Healthy Start champions. Sorry, put my teeth in those children's centres across the city.
Okay, I have got one other question, and it doesn't actually relate to Healthy Start. I used to be a practice manager in a GP practice, and it happened numerous times while I was in the GP practice, but it's happened twice while I've been volunteering at the food bank, where people have come in with a fine, a letter that they've been fined because they automatically assumed that they were free. They got their prescriptions free, but that's not the case. I know that that's not the case. They have to sign a form, but these forms have not been offered to them. Now, I think possibly 3 of the cases could be due to language barriers they've not understood. But in the new mother's kit, is there something that says that they make it clear that they have to ask for the form, or the form has to be offered to them? Because the fine is taking money out of their pockets.
Yeah, I mean, midwives at the booking appointments, which is part of that booking process, is to check whether they've got, it's called the FW8 form, and to check whether they've had that signed. Yeah, they've often had it already signed by their GP or another health professional, but if they haven't, the midwives will do it for them there at that booking appointment. So it's usually, well, it's embedded kind of into that process, you know, and there's like questions that we follow, and it's like on a checklist. So I'm surprised that that's happened, but I'll certainly look into it. And yeah, I mean, there's 2 processes of doing the FW8. You can either do it online, or you can do it as a handwritten kind of prescription, if you like. It's really important that all women get that signed off, because it's not just free prescriptions, as you know, it's free dental care as well.
Yeah. I know that's not part of it. I'm sorry, I've hijacked that, but I just wanted to check because it does happen, you know. So.
No, actually, it's very helpful to raise that. It's an issue that Maternity Action's been looking at, because we are finding a worrying number of women who should have been issued with a maternity exemption certificate for free pharmaceuticals, but for some reason haven't been, often through no fault of their own. The application should have been made online and it wasn't. And so they find out that they haven't got the maternity exemption certificate when they get sent a bill, both charges for the prescriptions and fines for having obtained free prescriptions. And of course, there is some provision for backdating the certificate, but it's only backdating by a month. There's absolutely no reason why you shouldn't be able to get it fully backdated and the charges and fines dropped, but that would require government action. So we are campaigning specifically
just
for
to
that
raise
change.
one issue. A GP won't do it anymore.
It shouldn't be left to the women to be chasing this.
No,
I think just to be really clear.
Yeah. No, it shouldn't be left to the women to be chasing. But what I'm explaining is GPs won't do it anymore because they see it as not part of a service they provide. Unfortunately, they perceive maternity services to be provided out of their domain now. So I'm just highlighting the issue. That's all. You know.
No, it's very helpful. It's one that we're quite concerned about. For the women who are affected, it can be quite a lot of money at a time when they really just don't have any spare money at all. Thanks very much, Veronica. We have one other question, and after that I think we're moving into breakout groups. Helen, would you like to ask your question?
Hi, thank you. I'm not sure it is a question, but I just wanted to say thank you to Grace. But it's really interesting to see, you know, starting that project and making all of those connections and the positive impact you've had, because Dee and I are just about to embark on a similar kind of maternity action based project for Manchester. So looking to kind of replicate some of the wonderful things you've done would be where we're gonna go. So thank you, and also really just to kind of give Sue a quick wave to see if we could link up in a very similar way, because accessing women who are coming regularly in to meet with you guys, to let them know that these, you know, the advice is there for them would be wonderful. So it was really just a kind of wave. Thank you.
Yeah, no, that's great.
Absolutely.
Thank you. Get in touch, definitely. Thank you, Helen.
Great, thanks very much, Helen. Okay, we're going to move now into breakout groups. What we're going to do in the breakout groups is, we're going to have a break. We're going to have just a quick break. And after that, we'll be moving into breakout groups. So just to sort of flag up in advance that we'll be looking in the breakout groups at what we should be doing to campaign for change. So what are our most important campaign asks? Who do we want to influence? What arguments do we think will persuade them? So we have facilitators lined up for those groups, and it's 11:47 now, so 11:52. If we could come back in 5 minutes, and then we'll move straight into those groups. So 5 minutes. Thanks very much. Hello, everyone. Hello, everyone. I think we've all returned from the breakout rooms. So what I'd quite like to do now is ask someone from each of those rooms to report back. I think, Kate, are you reporting back from the first session? Would you like to speak?
Yeah, okay. So we started off talking about Healthy Starts and concerns about the number of people missing out, and how, you know, if you replicated the figures from Manchester across the UK or across England, you know, how concerning that is about the number of women that aren't getting through, either through lack of awareness or because the system's so broken and isn't working properly. Also issues around language, that if English isn't the first language for women, then they need to be able to access things in different languages, and how we can make that happen. We also spoke briefly about the NHS exemption certificate for free prescriptions, and again concerns about how women are facing fines and not getting the free prescriptions that they're entitled to. So again, a lot of this is around raising awareness about people's rights and entitlements, and the fact that the government's not doing enough to assist that. So whether that is kind of partially at least deliberate as a way of saving money, there's a lot more they could be doing that perhaps we could be doing jointly around that. And other things was about refugees and no recourse to public funds not being able to access these benefits, and how wrong that is when they're amongst some of the poorest and the people who need this the most. We need more information as well. We're talking about cheap, nutritious food and lack of awareness amongst people about how to make cheap, nutritious food. So again, that would be useful. In terms of who we need to influence, we need to perhaps network with MPs, offices, councils, and there's a lot of work that we feel we could do between campaigning groups that have got similar sort of targets and objectives, particularly around raising entitlements among women about their rights and entitlements, and raising awareness about the longer term impacts on mothers and babies and the costs in the long term of, for example, the impact on their health, and how, again, a lot of people aren't aware of this, and this is one of the arguments that we could use to try to persuade people that more needs to be done. That's just a really quick summary.
Thanks very much, Kate. And from our second session, who's reporting back on that? Anna? Yep.
We talked about improvement in access to Healthy Start in one of two ways, perhaps by making the scheme universal, or well, and also by adjusting payments to match inflation. We talked about good practice that could potentially be scaled up, like embedding Healthy Start into applications, Healthy Start applications into the maternity pathway, training volunteers in children's centres in low uptake areas. And we talked about needing a commitment to investing in existing communities. There's a bottom-up approach, embedding grassroots supports, and that is done through, for example, using community languages and addressing barriers like literacy. We also talked about advocacy and supporting those who are unsuccessful in their application, and how, helping them to challenge this. Not everybody will know how to do this. Simplifying access to the system. The application process can be quite complicated, and this needs to be simplified. We also talked about linking community assets together to improve access. So you have communication between different community groups and services. And we talked about families with no recourse to public funds. There isn't sufficient data on them. We don't know how many families are out there who would benefit from the scheme, who haven't accessed the scheme. So who do we need to influence? We talked about child health and well-being policymakers and the DWP. The DWP have the data on eligibility,
and also the NHS BSA, which administers the scheme. And what arguments will persuade them? The cost of living, operating payments, the child health perspective, and the difference that the Healthy Start scheme makes. So there's been some really good data there from Grace that we can lift and show what a positive difference this relatively small investment can make. And yes, trying to get parents more support. So from the point of view that supporting families is to support, future generations and so forth. If I've missed anything, did any of you want to add anything? Otherwise, that's all from us.
Thanks very much, Anna. Well, I think we've come to the end of the agenda as we planned it. So the plan now is to wrap up today's seminar. We'll be writing up the notes from today and sharing them with you. And we'll also be back in contact with everyone who registered for the seminar as we go forward with our campaigning. This is campaigning aiming to achieve a decent, safe and healthy life for all mothers living in the UK. So I'd like to thank you all for joining us and for contributing your thoughts in the breakout sessions. I'd also like to thank all of our speakers for their brilliant contributions. Thank you to Unison, which has supported the cost of living work, and to Aberdeen Financial Fairness Trust. And I'd like to particularly thank the Maternity Action team who made today happen. So Anna Saros, Jerry Hickey, Lisa Roscoe, Michaela Lee, Neela Singh, Kate Moran and Sarah Bezic. So thank you very much, everyone.
Bye.
Thank you.